many people say, I didn't know that was because I had Parkinson's, so I couldn't do this. Or I didn't notice that I had problems doing two things at once. And so I think a physical therapist can help. They doesn't even have to see them for 10 visits every time you go, but I think going to a physical therapist to get your physical function and stability checked on a yearly basis is something that's being advocated more and more strongly. So I think getting them as part of your team, because they really can help specialize in which exercises are best and which areas you need the most help with to meet the goals that you have. So I definitely would advocate for early intervention with people who specialize in Parkinson's. Just like you've learned with your great experience with the doctors here, it's important to have someone who knows about what's going on. And so for physical therapy and speech therapy and occupational therapy, I think it's just the same. You need someone who knows what's going on in the process, who can help really look at all the things that are involved. So I second it.
Thank you. All right, question out of the audience again.
I want to back up a little bit and talk about the diagnostic side of this. It seems to me that some of the neurologists have a difficulty differentiating between essential tremor, Parkinson's, Parkinsonism, but there was one other. But anyway, can we talk about some of the diagnostic tools that are involved there to try to get that diagnosis? And more importantly, how important is it to have a precise diagnosis of PD, or does it matter if you have essential tremor and have been diagnosed with PD, or talk a little bit about that?
Sure. So I would say, I'll repeat what I said, but I will say that what I said is exactly accurate for your question. So all of those disorders, whether it be essential tremor, Parkinson's disease, or other forms of Parkinsonism, all of those are made by history and exam. So having experience in those disorders are going to facilitate a diagnosis. It's just like you wouldn't take your Tesla to a Ford dealership, okay? Because they don't have experience in a Tesla, okay? So as things become complicated, just like we have cardiologists who specialize in abnormal electricity in the heart. So we have a sub-specialist. The same happens in neurology. Neurologists are generalists in the nervous system. So you learn about multiple sclerosis, peripheral neuropathy, headache, Parkinson's, all those things. So you get a broad education. But sometimes a neurologist could go through training never having a dedicated month about Parkinson's or any of those disorders. It's not required in our training. So Dr. Alvarez and I did extra training in movement disorders. So 1 or 2 years, and then additional years doing research. So that is how the best way to make a diagnosis is to go to someone who's seen all of those and can distinguish them by history and exam, because there isn't a test to distinguish them. Now, I did mention that the DAT scan, which isn't a CAT scan, it's a DAT scan, dopamine transporter scan. That can look at that dopamine neuron, and I will go back to it just so you can see what I'm talking about. Tony rationed me to only a few slides, so what the dopamine transporter scan does is we give something in the vein, and it's taken up in the brain by the cells where there's a transport, and that's the little equal sign that says dopamine transporter. It binds to that. So it gives us an indication as to how many of those dopamine cells are there. It doesn't give us a number. It compares side to side, one side of the brain or the other. It also compares normal versus abnormal. But it's very dependent on the experience of who reads that scan. But it still doesn't distinguish between regular Parkinson's disease, progressive supranuclear palsy, other Parkinsonian syndrome. So, in essential tremor, it's normal. But it doesn't tell you it's essential tremor, because a lot of times essential tremor is misdiagnosed. It's actually a tremor from dystonia, another disorder. So, to summarize, it's based on the experience of the examiner, Dr. Yankov, who's been around more than, well, a long time, and has a lot of experience, and then doctors who have done special training in that area. And so that's the best way to distinguish them. And then the second part is, yes, it makes a difference, because how we approach the disorders, what we anticipate, how we're going to plan is dependent on the diagnosis. And so we don't have cures for any of those, but we do have interventions that affect long-term outcomes. So that's the answer to the question. Did I answer that?
Yeah, I think that was the important thing to pull out of it. There's no objective tool at this time.
Well, no.
Other than that's here.
No. The objective tool is the history and exam.
Yeah, that's.
Don't rely on a test or a pill all the
Yeah,
time.
there's no
Right.
drug test, blood test.
But, a lot of times the diagnosis of appendicitis is made on history and exam. It's no different. Okay, so there doesn't have to always be an x-ray or a blood test to diagnose it with certainty based on the criteria set up for that diagnosis. Yeah. Okay, next question.
Yes, Dr. Pepper,
Yes.
I know you mentioned Agent Orange is one of the things that lead to Parkinson's.
No. I didn't say that.
Okay.
I said there's two risk factors that have been associated: age and family history. Everything else is of research interest, but we don't know the cause of Parkinson's disease. So no, Agent Orange isn't a cause. Now, there is data that suggests exposure may increase risk. And so the government has supported that with funding veterans to get care.
My
But
question
it's not the
was-
cause.
My
Oh,
question,
where are you? Oh, there you go.
my question is, what about the petroleum industry? When I was in the Navy, I worked around all the fuels, and then after I retired, in the civilian as well.
So again, those associations are of research interest, but those aren't causes of Parkinson's disease. Remember, Parkinson's disease has been in the literature since the 1800s. Okay, we didn't have Agent Orange back then. We didn't have petroleum products back then. And so most likely there's a genetic predisposition, and then perhaps there is a trigger. Whether that trigger is internal, external, affected by external, is still of research interest. So we have to really be clear with our language so we don't misstate it. Okay, next one.
Good morning, Doctor. I know this is a non-drug session, but I do have a drug question.
Sure, I think you should ask.
All right. I happened to witness a video of glutathione therapy. It was absolutely outstanding. The individual had severe tremors. He went through a therapy, and 30 minutes later, he was walking and talking normally. Can you give us a little information on this glutathione?
Yeah. I'm going to defer to Dr. Yankov so I can calm down, and then I'll react.
Take a breath. And let's say
This is the glutathione is an antioxidant. All the body needs antioxidants, and mitochondria too. Mitochondria don't work very well in Parkinson, Alzheimer, other dementia. That every antioxidant, especially IV antioxidant, can help. But this is not proven yet by FDA. This is one case, we don't prove nothing yet. We have also other case with NADA, other antioxidant, that help Alzheimer, but it's a temporary help. You cannot put the glutathione every day. You better make antioxidant from the food you eat every day. And now you can make choice to have antioxidants in the food and not to have gluten and other food who interfere with the antioxidants. That's why antioxidants is a big deal in any disease, including in Parkinson.
And you have to be careful about any single case
course.
Right, and so there is interest, there's been long-standing interest, it's been looked at the Parkinson Study Group. The data doesn't support its value compared to placebo or, as Dr. Yanko said, to other avenues of antioxidant treatment. And so, and any intervention in Parkinson's disease has a high placebo response. 30% response as a placebo in all of the studies that have compared placebo to an active trial. So we have to be very careful about single cases. And as you know, day-to-day, Parkinson patients fluctuate all day long. They may have times where the tremor's worse, it gets better. So you don't know whether the patient had taken another medicine or whether they were just on it. So you have to be really careful about single case videos on the internet. And we're going to show you things that have data to support it. So I would always ask, what's the data that's supported, and is it done in a placebo-controlled fashion? And if they can answer yes, whether that be glutathione, stem cells, marijuana, we can go down the list from last symposium. I'm sure that's going to come up, so we'll talk about that. But always ask that question. Placebo-controlled trial where they were blinded to the intervention.
Have you ever had experience with this glutathione?
I've had patients that have gone to have that infusion, and that was their own decision. I don't recommend it. I don't think Dr. Alvarez does, because if the data doesn't support its utility in affecting long-term outcomes, and it doesn't affect the symptoms at the time of administration. Okay. So I'm told I'm supposed to rotate, so we'll go to Alex. Yeah.
Hi, this is for Dr. Alvarez.
Okay.
You know my husband, David. He recently, he's had Parkinson's since 2010. He recently had a small stroke, and now they can't control the confusion and hallucinations. Is there anything we can do about that to help him?
So what can we do to a patient who's now experiencing confusion, they have history of Parkinson, and they have recent diagnosis of stroke? That's very, very hard to absorb, even for a physician, but we have to do like by logic and doing by history again. So patients eventually will have confusion, especially if they have coexisting dementia. But if it's something related to recent admission to the hospital because of stroke, I'm sure the doctors that's taking care of your husband's making sure that there's no coexisting UTI, there are no metabolic problems, he's not dehydrated, there's no sound downing because he's obviously in a hospital setting, so he's not used to the area, there's a change in his sleep time. Also look at if they gave him new medication, because some new medications can cause confusion. And hopefully a lot of these are just in an acute setting and will eventually improve. But after a stroke and patient is already done with rehab and they continue to have confusion, then when they come to my clinic, maybe I'll talk to them about what's going on with their cognitive function. So maybe the dementia is advancing, because as you know, Parkinson and dementia is very, very coexisting in most parts. The disease advance, the age itself is one of the factors for the dementia with Parkinson and Parkinson with dementia. And then I will also review my patient's medication. Maybe it's the right time for me to readjust, because some of the Parkinson meds can also cause confusion. Okay? So it's not going to be a one-time thing, but it's going to be a logical step-by-step.
All right, we're going to continue with questions, but we'll go next to our next topic. So, before we start this topic, which is looking at fitness, I want to get a hand raised from any of you who have ever bought car or home insurance. Just raise your hand. All right, so just remember that as we're going to talk about fitness. So I want you to keep this arc in your mind as we talk about it. And sickness doesn't mean Parkinson's or essential tremor or whatever neurological diagnosis you have, because that's your new normal. That's you now. You're a person living with Parkinson's. That's not what I mean by sickness. Wellness is based on measurements that I've listed there. Blood pressure, body fat, bone density, your triglyceride level, your cholesterol, flexibility, muscle mass. That's what I mean by wellness. Fitness is beyond wellness, and I want you to think of fitness as your insurance to when you develop sickness. Almost everyone raised their hand that they pay for insurance on their home or insurance on their car. And why do you get that? To blunt the effects, the trauma, the financial trauma perhaps, of a sickness of your car or your home, whether that be a fire or a burglary or an accident. You have paid money, and good money, probably quite a bit of money every year, ensuring that the trauma of sickness of those entities is blunted. So how many of you have done the same for your own times of sickness? And this is exactly what I'm talking about with the last question. Here's a patient who's had Parkinson's disease, perhaps has done reasonably well, now has an insult, a stroke, and is in the hospital, has a new episode of sickness. How much fitness insurance did that individual have to blunt the effects of that new trauma? Okay, and so think about that, how much you're willing to invest in your home or your car, but not your own sickness insurance. And I'm not talking about paying health insurance, I'm talking about your fitness insurance. So that's the arc I want you to think about as we talk about fitness today. So in the United States, we spend $3 trillion on healthcare. Trillion. And this isn't treatment of prevention, it's treating disease. What did I say before? It's better to prevent than react. We treat disease in this country. And that's a big change since the beginning of the 1900s, where exercise was a part of treatment. And then in this country, we became a nation of spectators. We pay money to go watch people exercise, whether it's on the basketball court, the football field, the soccer field, the tennis court. Okay, so think about that. That's what we've become. And we don't, despite spending the most of any nation in the world, our average life expectancy is 78.8, and that averages out male and female. That's 43rd in the world. 43rd in the world. So if you want to make America great again, let's get this number up. Now in the United States, 20% of people get the amount of recommended exercise. And I'm sad to say that I'm part of the baby boomers, but 50% of the baby boomers report doing no exercise. Thankfully, I'm not one of them. But 50% of baby boomers do zero exercise in the United States. And 80 million people over the age of 6 are entirely inactive in this country. Inactive. And so that's why I say, oh, sorry, Tony, sitting is the new smoking. Okay? So that's what I want you to think about. Sitting is the new smoking.
Dr. Pepper, can I interject?
Yes,
I'm
go
so
ahead.
sorry.
Yes.
That means that right now, we've already been sitting for more than 30 minutes, and if it's okay,
Of course.
2 seconds.
Yes.
All right, those of you who can stand, please do come to standing for just a few. Take deep breaths. Those of you who cannot stand, squeeze your buttock muscles. Take a moment. Just kind of shift around a little bit. Stand up for just a few breaths. Inhale and exhale. Squeeze your buttocks. Make your muscles tight. Breathe. If you can't stand, move your legs a little bit. Breathe. We have to take breaks to stand and stretch. All right, now that's probably enough so that we can continue with our presentation. Thank you so much
Thank
for
you. Yes, anytime.
allowing us. Here we go. Come back to sitting down.
Yes. All right, and so this isn't a novel concept, but it is a concept that we've forgotten in this country. Whenever I travel, I see how other countries move. When I was in Amsterdam, everybody was on a bicycle. You had to really watch out when you walked because people would run you over on a bicycle. People walk everywhere in Europe. We are a nation of sitting. So it's important to recognize this, and this is something that a physician back in the 1700s stated, that of all the causes which conspire to render the life of man short and miserable, none have greater influence than the want of proper exercise. So this is not a novel concept, but a concept we've ignored. Yeah, go ahead.
So I was just going to say there was a really interesting study with animal models that had Parkinson's, and they found that if they sat, their Parkinson's progressed faster than the mice that did it. And so there's lots of different ways to look at this, but that was a special study that categorized it as a disease of neurodegeneration. The more you sit, right, the more it worsens. So 100% give enough props to that statement.
So again, the way to keep you on the right side of this arc is what we're going to talk about the rest of the day. Exercise and diet. And even back in the time of Hippocrates, he said, eating alone will not keep a man well. He must also take exercise. So these are not novel concepts we're dealing with today. So if I had a drug that had all the benefits of exercise, all of you would be willing to pay an enormous copay in order to take that drug. But many of you don't do something that is potentially just free to help yourself, and we're going to talk about that. Exercise is to be taken often. It's not something to do. It is something to be taken often. Okay, it's not something you do. And if you take it often, you will live longer, healthier life, have lower medical costs, sleep better, be more productive, and lower your risk of developing almost any chronic disease. It's been associated with decreased rate of heart attack, stroke, type 2 diabetes, and at least 13 types of cancer, including the most common, breast, ovarian, and colon. And eventually, I'm hoping that we will see exercise as being prescribed as real medicine with dosages. Now we're just trying to get you from not sitting. But eventually, Dr. Alves and Yakov and I will be giving you dosages. And some of you already get that from me, but we are going to talk about broad comments today, and then our therapists will help us get a little bit more refined when you meet with them for what is important for you. Now, when you exercise, there are many different ways you can sweat, but there are two broad categories. It's important, regardless, to find something you enjoy, because if you don't enjoy it, you're not going to do it. So, of all the types, find something that you enjoy. But there's two main types. Aerobic, this is the most popular, where you have increased breathing, faster blood flow. 50% of Americans meet recommendations for aerobic exercise. But we need to also consider strength training, and I'm not talking about lifting weights at goals and pressing, or even CrossFit. I'm talking about building muscle strength and strengthening bones. And 20% of Americans have some sort of strength training in their exercise. And strength training only needs to be your body weight as resistance, which can be done in yoga, tai chi, Pilates. So it involves no dumbbells or barbells or anything that would seem unreasonable. So strength training is important as part of your overall exercise. We'll get some insight into that from our panel. Exercise works for everyone, young and old, and if done correctly, has few or negative